Well, why don't we get started then? Good evening, everyone. Thank you so much for joining us tonight. My name is Shelby Luce. I'm the Antibiotics Program Associate with US PIRG, which is a nonprofit, nonpartisan advocacy group, and we work on all sorts of different issues related to public interest across the country, but antibiotic resistance is one of our main, our priority campaigns. So this is our second annual antibiotic resistance panel here at Harvard Law School. And this is a particularly timely event as this week, you might be aware, is Antibiotics Awareness Week, which is an international week dedicated to raising awareness about antibiotic resistance. And I think having a time for this week and one of the reasons why we have such a wide variety of stakeholders and participants in the panel this evening. Are you good?
I don't think you're being picked up on the microphone for that recording, so.
Sure, we'll start that over. Thank you very much.
Sure. There's a podium mic there. But
no worries. Just give me 1 second. All right, is that better?
Yeah.
Yeah, cool. Okay. Well, I can start over just so we have that all recorded. So again, my name is Shelby Luce. I'm the Antibiotics Program Associate with US PIRG, which is a nonprofit, nonpartisan advocacy organization, and we work across the country on all sorts of different issues related to the public interest, with antibiotic resistance being one of our priority campaigns. And this evening we're so excited to have you all here for our second event here at Harvard Law School, our second annual event on antibiotic resistance. And this is a particularly timely event because this week is Antibiotic Awareness Week. It's an international week dedicated to raising awareness about antibiotic resistance. And I wanted to just briefly start by talking a little bit about the issue and why having an event this week with a variety of stakeholders involved is so important to raising awareness about the issue, but also to solving the problem. So without swift action, it's predicted that by 2050, we will have more people dying of antibiotic resistance, or could have more people dying of antibiotic-resistant infections than cancer kills today. That's roughly 10 million people every single year, or about 1 person every 3 seconds. And despite this problem, we as a society continue to misuse antibiotics in all realms, from the medical setting to the food industry setting. And as I'm sure many of the doctors in this room could say, we are seeing infections more frequently that are difficult and sometimes impossible to cure with our current antibiotics. US PIRG recently launched a network called the Health Professional Action Network, which is a mixture of doctors and health professionals from all across the country who are committed to educating the public about antibiotic resistance and also talking to decision makers about the issue as well. So I want to share briefly a quick video that we made for this week. And it'd be wonderful if after the event folks could share this on Twitter and Facebook. We're almost at 3,000 views and we're very excited about it. So I'm just going to play this here. Hopefully the sound works.
The World Health Organization has identified antibiotic resistance as the #1 public health threat of the future.
We would not have cancer chemotherapy, complex surgical management, intensive care unit, organ transplants, care for premature babies, if we didn't have effective antibiotics.
It can get to the point that we have what we've heard of as superbugs.
That 23,000 Americans die every year from infections that are resistant to every drug we have. It makes you angry. It makes you wonder, how did we get to this point?
The more we use antibiotics, unfortunately, the less effective they become.
Antibiotic resistance is driven by a variety of factors. So we have overuse of antibiotics in the clinical setting.
That doesn't even begin to cover the inappropriate use in animals, which greatly outweighs the amount of antibiotics we put into people. About 70% of the antibiotics sold in the United States are put into animals, not people.
They're used for ways to make animals larger or to make up for poor conditions of the animals.
Animals receive antibiotics on a daily basis.
In humans, we would consider this abuse of antibiotic use. But in agriculture, unfortunately, there was a point when it became an industry standard. The routine use of antibiotics in agriculture has some disastrous implications for public health in humans.
Why are we allowing that to occur?
We could reduce the use, these 70% of antibiotics, down to just therapeutic uses. If an animal is actually sick, we should go in, a veterinarian should prescribe antibiotics and help that animal get well. But we don't need to do this pre-dosing. Consumers can play a big role here, and they can make decisions with their pocketbook.
And that will help businesses understand our customers are asking for a move into this market segment, the antibiotic-free meat segment. The alignment of market forces with public good is something you don't see very often, but we have it here.
Policymakers, the food industry needs to respond to this public health threat.
Little did you all know you were in the room with a celebrity right now. Okay.
Has identified antibiotic risk.
There we go. So clearly there are many different factors that contribute to antibiotic resistance, and that's why it's so necessary to involve a variety of stakeholders in the solutions. So for our panel today, we will have two discussions. In the first, we'll talk about approaches to antibiotic stewardship and research and development. And in the second, we'll talk about how food companies have outpaced policy when it comes to antibiotic stewardship. The panelists will each have a few minutes to introduce themselves and talk about their work. This will be followed by discussion and then some time for question and answer. But now it is my pleasure to introduce our first segment and our first moderator, Ed Silverman. Ed Silverman is a senior writer and PharmaLaw columnist for Stat News and has covered the pharmaceutical industry for the past 2 decades. He previously worked at the Wall Street Journal, the Star Ledger of New Jersey, New York Newsday, and Investors Business Daily, among other publications. He won the Gerald Loeb Award for Business and Financial Journalism in 2018 for his PharmaLaw View columns, along with several former Wall Street Journal colleagues, and was a Pulitzer Prize finalist in explanatory journalism for a series of stories on prescription pricing. He earned an accounting degree from Binghamton University and a master's in journalism from New York University. And Ed, I'll hand it off to you now.
Thank you, Shelby. And thanks everyone for coming out tonight. It's very nice to see you. We're going to talk a little bit about how about some of the challenges facing development of antibiotics. There's a big problem, but before we get to that, I'd like to introduce all the panelists here. First of all, on the screen to my upper right is Kathy Talkington. She's the Antibiotics Project Director at Pew Charitable Trust. Feel free to wave to her. To my far right is Sujit Suchandran, a doctorate and infectious disease specialist at Leahy Hospital. And to my immediate right is Matt Wellington, Director of the Antibiotics Program at US PIRG. So before we get into the topic and some questions, I'd like each of them to talk a little bit about what they do. So Kathy, if you can hear me, you can go first.
Yeah. Sure. Can you hear me okay?
Yep.
Great. Thanks for the opportunity to talk today, and again, apologies for not being there in person. As was mentioned, I work for the Pew Charitable Trust, and for those who are not familiar with Pew, it's a nonprofit organization that works on a variety of public issues ranging from environment to prison reform to a number of health issues, including antibiotic resistance. And he feels like this is a critical issue to be working on. As was mentioned before, it has significant implications for public health. We talk about it as underpinning all of modern medicine as we know it. So the issue is serious. We see the increasing sort of superbugs as we hear. At the same time, we don't have an adequate pipeline of new therapies coming along. So what I was going to show a few slides, but I think we had some technical challenges, and I can share those with folks later if it's helpful. But what I wanted to do in my sort of introductory statement was just lay out the challenge that we're faced with on the innovation side. What we're looking at is most of the antibiotics that are in use today are based on scientific discoveries made over 30 years ago. We have not seen a new class of antibiotics in quite some time, and that's a problem because the resistance can be more easily adaptable to similar technology or similar types and classes of antibiotics. So with that void in discovery, that creates a resistance problem. One of the things that we've done at Pew is tracked the pipeline of antibiotics over the last few years, and we update that periodically. And our most recent analysis shows that there are currently 42 antibiotics in development. And while some people might argue that sounds like a reasonable number, once you start sort of digging it down a little bit, you realize it's not adequate. For example, historically, only 1 out of every 5 infectious disease drugs makes it through the development process to the bedside. Only 11 of these 42 will address the critical need issue that the WHO has prioritized for the bacteria that we are most concerned about. And only about a quarter of these are what would be considered to have the potential to be novel innovations or have new mechanisms of action. So once you start sort of winnowing that down, you realize the pipeline is insufficient. At the same time, we have seen sort of exodus of companies developing antibiotics. There are just, even in the last couple of years, we've seen some significant players getting out of the business. We saw Novartis leave, AstraZeneca, Sanofi, Allergen, the medicines company, and unfortunately this seems to be a pattern that we hate to see happen, because these are the kinds of companies we need in the business to make these antibiotics we so desperately need. Some of the reasons that the companies gave for exiting the company, exiting the area, most have to do with economics. The sort of the value proposition of making antibiotics doesn't compare well to the development of other types of therapies. Some of the quotes, and I don't have them in front of you, but they said, for example, Novartis wants to focus more on neuroscience and ophthalmology. Sanofi wants to focus more on cancer, diabetes, and cardiovascular diseases. So when you're comparing the sort of the value of their investments in antibiotics versus some of these other drugs, unfortunately, antibiotics are losing out of that proposition. And I'll just end with 2 other quick facts, just to give you sort of the sense of some of the challenges. Is of the 38 companies with antibiotics currently in clinical development, only 5 rank among the top 50 pharmaceutical companies by sales, and this number keeps declining. And then roughly half of the pipeline companies are considered pre-revenue, meaning they have no products currently on the market. So while we are seeing the rise in resistance, we at the same time are seeing a sort of an exodus of big companies for sure in the development of new antibiotics. And I know in the Q&A we're going to get into a little bit more of why that is, and maybe some of the ideas that are being proposed to deal with that. I guess I would just tee that up by saying, in my perspective, the 2 primary challenges are scientific challenges, the science is hard, and economic challenges. So I'll stop there. Thanks.
Thanks, Kathy. Sujit?
Great. Thank you, Ed. So again, my name is Sujit Suchendran, and I'm an infectious disease physician at Leahy Hospital and Medical Center in Burlington. First of all, I want to thank the organizers for inviting me here to this panel today. It's really a pleasure for me to be here. This issue of antimicrobial resistance and microbial overuse and thinking about antibiotic use is one that I really live and breathe every single day in my career. It's something that I see in all the patients that I see in the hospital. And I'm really the end user of a lot of the things that you're going to discuss today in terms of the development of new antibiotics and how those get deployed in the hospital setting. I'm the one that, in the end of the day, uses all of those. So I have a different perspective on this issue coming from the healthcare setting alone. And the 2 things that I would sort of kind of focus on first are what I spend a lot of my time doing is thinking about the judicious use and the stewardship of our existing antibiotics. And I also think about, secondarily, how we deploy new antibiotics and how we choose them and how they get deployed in the hospital and healthcare setting. I will say that in the last few years, the landscape in how we think about antibiotics and antimicrobial overuse in the healthcare setting has very much changed. When I was in training doing my infectious disease fellowship and learning about antibiotics and infections, we didn't really formally think about the structures of how we get hospitals and healthcare settings to think about reining in and correcting antimicrobial overuse, but it's very much a part of the healthcare conversation now. And I think that really goes to some of the changes that came and the recommendations that came from the federal government starting in 2014 with President Obama's executive order and then a national action plan combating antimicrobial resistance. That really led to some formal changes in the hospital setting where hospitals were essentially mandated to have antimicrobial stewardship programs. And the one way that got mandated was through the Joint Commission, which is the accrediting body for hospitals. Basically, hospitals had to have an antimicrobial stewardship program. It didn't have to be a good one, but they had to have one, and that became a requirement. And every 3 years, the Joint Commission visits your hospital, and a bunch of surveyors come in and ask you questions and make sure that you're complying with all those. And we actually had our survey last year, which was a year that the antimicrobial stewardship requirement went into effect. And the Joint Commission surveyors did ask us about it, and it became an important topic of conversation. So this is definitely a change that hospitals are having to deal with, and it's also going to affect the payment structure for hospitals as well, as the Center for Medicare and Medicare Services, or CMS, will likely make it a condition of participation for payment that hospitals have to have stewardship programs. So this is coming from top down, and a lot of hospitals are really thinking about the antimicrobial overuse. So I think about it in the structural setting, but really also in the very day-to-day and individual clinical setting where I see patients for whom, as you've heard from the videos and Shelby and other speakers, that there are definitely patients for whom we do not have antibiotic options. I have had a number of patients who have had very severe blood infections, bone infections, and when I look at the resistance profile about the available antibiotics that I can use from the microbiology lab, there are none. And those are the most extreme situations, and they get a lot of the attention. But there are lots of situations in the middle which are, I'll go on, which are also very common, where there may be antimicrobial resistance to multiple classes, perhaps not all classes, but multiple classes. And you may be scraping at the bottom of the barrel and using more toxic antibiotics. And while those don't get a lot of attention because they're not as sort of sexy as the completely drug-resistant pathogens, those have a lot of effect for patients when we choose second-line agents, which are often inferior. So I see this, I have to think about the way we use antimicrobials in a hospital and individual patient level. But I'll also focus on the point that we're going to talk a lot about today, which is antimicrobial development and how those get used in the hospital. As director of our Antimicrobial Stewardship Committee, I'm also the co-director and co-leader of our Antibiotic Subcommittee, which sits within the Pharmacy and Therapeutics Committee of our hospital, basically to think about how we choose and which antibiotics we add to our hospital formulary. And as Kathy mentioned, there are very limited things that we've had to add to our formulary because there are very limited options. In the 3 years that I've been the co-leader of our antibiotic subcommittee, I can only think of 2 antibiotics we have added to our formulary, and those are both within existing classes of medications. They're basically sort of different versions of antibiotics in the same class of cephalosporins, which is a very old class of antimicrobials. And as my co-director and I were looking towards what antimicrobials we may be sort of coming down the pipeline, and we will be having formulary discussions of, they're all within classes of antibiotics that already exist. So really not novel medications. So those are the 2 things that I wanted to mention, just thinking about stewardship and thinking about how I use antibiotics and choose new antibiotics in the hospital setting. And I'm really looking forward to this discussion.
Thanks very much. Matt?
Yeah. Hey, everybody. Thank you for coming out in the cold. So my name is Matt Wellington. I'm the program director for US PIRG's antibiotics program. I've been working on antibiotic resistance for about 3 years, definitely an issue that is near and dear to me, and I'm happy that I get to work on it. So from US PIRG's perspective, and we'll hear more about this on the second panel, primarily we've been focused on how do we reduce use, right? So Sujit's working on that question in the human healthcare setting, which is something we definitely need to do, but we've primarily worked on it in food animal production. How do we reduce the overuse of antibiotics to produce the meat that we eat, right? And that's definitely going to still be our priority moving forward, but for me, working on this for 3 years, it's just so clear now that we absolutely have to develop new antibiotics. The pipeline is running dry, as Kathy mentioned. There's significant challenges and barriers for companies to develop effective antibiotic treatments. And I want to just talk about like my experience working on the periphery of that. This is a relatively new space for US PIRG that we want to get into because we think, you know, we're advocates. We're able to find common ground. And I think that this is one of those instances where we can make a real difference in working with all of the different stakeholders in antibiotic development to come up with a comprehensive solution that will get us to where we need to go. So, you know, for me, one of the things that I wanted to take away from the panel is just feedback and working with other folks who are more kind of embedded in this part of the antibiotic resistance puzzle. But there's definitely clear things that I've seen. So as Kathy mentioned, there are significant challenges, one of which is economics. It takes a ton of time and money to produce antibiotics. I remember I was looking at this New York Times video interview pretty recently, and it was all about this researcher who's been crawling around the caves, like ancient caves all over the world, to find the next microbe that will produce an antibiotic. She said that it's going to take like $10 billion to produce one antibiotic, and the time frame for the project is 10 years minimum, probably around 25 to produce an antibiotic. And it just blew me away because, you know, if you think all of this time, all of this money, first off, we better make sure that we use these drugs wisely. Otherwise, we're just going to keep kicking the can down the road, and people are going to keep having to crawl through the crevices of the earth to find whatever next thing is going to make the new antibiotic. But the reality is that if companies take the time and the money to produce a new antibiotic in this kind of way, people like me and Sujit and Kathy are going to say, don't use it. We're going to say, use it as little as possible, right? So our current drug development system, which is based on patents, which is based on, you know, revenues on sales and volume, I just don't think it's going to work to develop new antibiotics. And I've seen tweaks to the system and things that I think of as like Band-Aid approaches to fixing this problem. And when I meet with legislators, I was just talking to a healthcare staffer in DC about antibiotic resistance earlier this summer, and she mentioned to me this bill that was being put up, and part of it was that it would expand market exclusivity for drugs. And again, this is a new space for us, but I knew from talking with some other colleagues in the consumer space that probably wasn't the best solution to addressing the issue. But she told me, you know, we're going to vote for it because we aren't seeing any other comprehensive solutions put in place that everybody supports. Mostly it's just people on the consumer side saying, absolutely not, this is a terrible idea. And people on the industry side saying, well, you got to give us something. We have to develop new antibiotics. And people like Sujit saying, yeah, we have to develop new antibiotics, so what are we going to do? And I think that's the opportunity, right? We know we have to think of a new system for developing antibiotics. I'm excited to talk about it and, like I said, get feedback. But for me, I think some of the key principles for how we're going to do it in a comprehensive way, number one is public financing. Kathy said part of the other challenge is scientific, right? I've heard from folks that work on this that really the bottleneck is in scientific discovery, so we need to get more public funding into the beginning of the process for developing effective new antibiotics. The R&D incentives, they should be targeted, right? That's the second piece, to where we actually need to develop new drugs. So things that Sujit's seeing in the hospital, the priority pathogens list for the World Health Organization, that's where we should be pouring money to produce antibiotics to treat these dangerous infections. And it should be targeted to new antibiotics, right? I think we've heard already that a lot of times we're developing these drugs that are just slight variations on existing classes of antibiotics. That's not going to help us in the long term, I don't think. So targeting those incentives to developing novel antibiotics is going to be really key. And then the next thing, which I think is really interesting, because there's so many different ways that people are thinking about doing this, it's delinking. Have people heard that term before? Delinkage, maybe? Not, I'm getting blank stares, so no. So that's good that you're here. So that's one of the words that I hear thrown around in these conversations is we need to achieve delinkage. Basically, it's just we need to separate the investment that companies make in R&D from their revenue based on, sales volume. We need to separate that. We need to figure out a new way, new way to give incentives to companies and new ways to make revenue that aren't based on just use and volume. And there's a lot of ways to do it that I think are really interesting, but that's one of the key ways to do it. Because like I said, if companies invest a ton of money and time to produce new antibiotics, we're going to say don't use them. And so if we rely on the current system of patents and sales by volume, it's still going to be really unattractive to companies. And I don't have an economics degree, but I know that that's the case, right? That's just basic sense. So the last piece, and I think the most important for any kind of comprehensive approach to developing new antibiotics, is stewardship, right? Like I said, that researcher climbing around the caves, if they produce a new antibiotic, we better use it wisely. It should be stringent stewardship guidelines attached. I think same thing goes for food animal production. If we get a new antibiotic, that should only be used to treat sick animals, not for some of the production practices you'll hear about later in the panel. And only after we've tested and figured out if everything else is going to fail, then we'll use this last line treatment. So, like I said, this is a new space for PIRG, but one I think where we can really make a difference and bring stakeholders together to find some common ground, and I'm eager to do it. So thank you all for coming to talk about it.
Okay, thank you. So let's have a conversation. I should note that we'll try to leave some time for questions. But first off, I want to ask you guys about something that was in a government report, a UK government report that was commissioned and issued 2 years ago, 2016. And it had a very sobering bottom line conclusion about the supply problem, the availability of antibiotics and new antibiotics. It basically said, we've not seen a truly new class of antibiotics for decades. So we've heard a little bit about the problems and maybe why that is. So I want to ask you folks a little bit about something that was raised in that report. And the report, by the way, was headed by a fellow named Jim O'Neill, who was a former Goldman Sachs economist. So they tried to get beyond just the obvious health policy issues and look at issues, questions, challenges facing industry and public-private partnerships and governments. Anyway, the report suggested something that was called market entry rewards of around $1 billion each that would be given to the developers of successful new antibiotics. And there would be conditions, though, to ensure that those new antibiotics are not over-marketed and yet are available to patients who need them wherever they live. The incentives would be financed by something called pay or play, a model in which surcharges would be imposed on sales from pharma companies that don't research new antibiotics. Meanwhile, though, I think Kathy mentioned, more and more of the largest drug companies are pulling out of the antibiotic market. Last July, the latest example was Novartis. They planned to end all research. They followed AstraZeneca, Lilly, Sanofi. So I have a question for the three of you. Again, let's have a conversation. To what extent do you think that proposal is viable? Because it's not taken off yet. I'm wondering if you have any insight as to why that is, and any thoughts about how we can move the ball forward and to a place where we can actually put it into practice. As you started to say, Matt, we need to find incentives for industry. How can we get industry to look at an idea, a concrete proposal, rather than just complaining and worrying and wondering how we get something done? Anyone want to take a stab at that?
I'm happy to start.
Yeah, go ahead, Kathy. Yeah.
You'll hear me okay? Sorry, we lost power at our house just to add to the fun, but so I got disconnected, so I missed some of the conversation, but I'm back. So in terms of the proposal that Lord O'Neill and his team put together, I think you're right. I mean, it's interesting. It's an innovative idea. It's bold thinking. I think that's the kind of thinking that we need in this space. We need to have something that's meaningful, that gets people interested and excited about making new antibiotics. But I think the other part of the equation, and I think the reality that we're seeing, is the political viability of that magnitude of public funding is challenging. I think that's what we're seeing in the U.S. I can't speak for all the other countries, but trying to get a $1 billion reward for each antibiotic that we deem worthy is tough. So I think part of the challenge is that, and there has been also some conversations about could there be a global fund, which is an interesting concept, but I think realistically that has its own set of challenges of sort of governance and who makes decisions and who puts in what amount of money. Some of the other thinking that is out there is, could the U.S. come up with their own market entry reward, maybe at a lesser amount? Some of the conversations we've been having with companies, especially the smaller companies, are saying they may not need that level of funding to keep them in the game. So I think we need to keep thinking, one, what's politically feasible, but also meaningful. Again, it's not easy. I don't have the answer, but I think part of the challenge of the proposal that he put forward is sort of the political reality of public financing.
Is there any other proposal that you are aware of that has been discussed in the same way, that comes close, that seems to get people motivated at all? Or is it maybe just a question of $1 billion is too much? Or are we really just nowhere right now?
I think there are different conversations that are out there. I think, as Matt mentioned, one of the things that we can do that hasn't been done successfully yet, but I remain hopeful that it can be, is getting everybody to rally around one proposal. As Matt mentioned, and as we have encountered, when you go to the Hill, each sort of set of companies or advocacy groups are coming to the Hill with different things, whether it's a tax incentive or transferable exclusivity or a market entry award that's massive versus one that's maybe a smaller one. So I think step number one is to get everybody sort of singing the same song on what needs to be done. I don't know that there is a uniform answer yet. One of the things we're in the process of doing is trying to accomplish that, bringing people together to see if they can agree to work together on a proposal and then hammering through what that looks like. But there is not one answer that's clear at this point, both politically and in being meaningful. But I am hopeful that we can get there. And again, I think it's going to be a smaller, probably something like a smaller market entry reward, and public, maybe some private funding, I don't know.
Just a crazy thought. What if we greatly extended market exclusivity? What kind of alarm bells might that sound, but what might be advantageous? Because I'll pick a number, 20 years. Maybe that's enough incentive? What's the upside and downside? Something of that sort. Whether it's 18, 20, 22, whatever really gets somebody in the industry to think, oh, that's different. That might be a way to get the payoff.
Can I chime in real quick on this one?
Sure.
So I think this is one of those proposals that's come up that I've talked to legislators about, and it seems like not the right place to put our energy.
Why?
Outside of this comprehensive solution. So for the expanding market exclusivity, what I've heard from other folks in the consumer space is, although that might move us forward in some ways for the antibiotic development space, you're putting the burden and the cost in a different place, right? So you're allowing a company to have more monopoly market exclusivity about, a cancer drug, for example, and then those consumers that have to get that cancer drug, that's less of a chance for them to have competitive pricing. So it's almost like putting the burden in another way.
Antibiotics, and I'll play devil's advocate. Yeah. Maybe it's better off having an incentive that gives a longer monopoly than no drug at all.
Well, I think
that's where I'm coming from.
Yeah, and I think my other point I was going to make to your question of the initial question about market entry rewards is, again, I think that doesn't address the scientific bottleneck. That comes at the end of the process, right? So that's why I think we need to be putting more incentive, more funding into the beginning stages of finding actual breakthrough therapies, things that are added value, not just the new antibiotics that are part of an existing class.
One of the comments I've heard on the market exclusivity, the challenge for some of the smaller companies is when they need money fast, they need it in the first couple of years to sort of get them over the hump Many of them don't have marketing funding, for example. They're more on the development side. And so even if they might have a longer lifespan on exclusivity, just getting over those first couple years is the challenge.
Okay, good point. All right, I'm going to switch to a slightly different topic. There's an increasing effort to reduce antibiotic use in food-producing livestock. But how big there are efforts in Europe? FDA here has taken steps as a voluntary program with industry. But how big a concern is it that there's something that I hear is described as a loophole, that antibiotics can still be used for preventing disease? What do you make of that? Because I'm wondering if there are more broadly lessons that can be learned from human health care that can be applied to that setting, and perhaps vice versa.
Yeah, I think it's good that this is coming up in this panel, even though this is the main topic for the next one, because it should be this kind of, it's the One Health approach, right? We need to think about it overall as where this is happening in human and food. So the loophole you're mentioning, so from our perspective, the FDA, they put guidelines out that have been officially implemented now in this past year, and they did a good thing, which was they eliminated the use of the drugs for growth promotion, making animals grow faster on less feed. That's a good thing. But the loophole came in because it turns out that many of those antibiotics that were approved for growth promotion and are no longer in use for that purpose, they're still approved for what's used as routine disease prevention. So, where there's no illness present necessarily in a flock or a herd, but they know that they're likely to get sick at one point in the production process, so they dose many of the animals with antibiotics. That is still a standard practice. And so if the antibiotics that were approved for growth promotion, many of them are still approved for this routine disease prevention, it's mostly kind of like a label change. It's not necessarily going to provoke meaningful behavior change. I think it's a good thing that they've done this, but we want to see much more action there. So I think that, we propose that antibiotics should only be used to treat sick animals, or if there is illness on the farm, to control a verified disease outbreak. But bottom line is there has to be illness diagnosed on the farm for antibiotics to be used. And that's not the case right now.
So in other words, they don't go far enough.
Yeah.
And I think I can comment on your question about how we can learn lessons from human antimicrobial stewardship and apply it to the food systems. I think that there's sort of a clear structure about how we can be successful in the the healthcare setting, and there's really outlined for us by CDC. I think one of the most important things is that you need to have effective leadership and accountability, and right now there is not that in the food systems. I don't think that we are holding companies and food producers accountable, and there's no real leadership in this setting in the way that we do have in the human healthcare setting. Another very important thing that I think that is now being done in human healthcare that is not being done in food systems yet is tracking and data collection. It is so important to know how much antibiotic you're using, why you're using it, what are the indications, and then being able to use that data and feed it back to prescribers. And that is not being done in food systems. And I think it's so critical for us to really understand the scope of the problem and then be able to feed that back to the public, companies, food producers. We need to understand that, and we are starting to do that in human medicine, understanding our data and feeding that back. And I do not believe that there are really any strong requirements that food companies really track their antimicrobial usage and then really respond to that. Also, in the human healthcare setting, we're starting to benchmark ourselves. We're starting to compare our antimicrobial utilization to our peers, and I think that comparison would also be a benefit in the agricultural setting for one company to know, hey, we're using 25% more of this class of antibiotics for this indication compared to our peers, and then that getting disseminated, for example, in media. I think those are very powerful tools to change human behavior, and I think those are some of the lessons that we could really apply from the healthcare setting into agriculture.
I looked at the screen when Sujit mentioned tracking because I knew Kathy was going to be nodding along to that one. You have comments on that?
Yeah, sure. I'll add a couple other things. I think it's an interesting proposition of what we can learn from the human side on the animal. And I think there are a number of things, some of which have been mentioned. I mean, stewardship in and of itself. I think we've seen from the CDC leadership the fact that they defined the core components of what stewardship is was sort of a pivotal point in hospitals beginning to implement that stewardship. Having the Joint Commission require the stewardship components, having CMS ideally require that for Medicare participation. We're not there yet, unfortunately, but it began that sort of trajectory of policy interventions to improve use of antibiotics. And so on the animal side, I think we need similar activity. We need to define what stewardship means in animal agriculture. We need the data, and there are a few things that FDA has recently proposed in their outline, their 5-year proposal that need to happen. For example, getting all antibiotics under veterinary oversight, improving the labels that are currently on antibiotics. We did some analysis of the existing labels, and about a third of them don't meet judicious use principles. We need to fix that, and we need better data, as you all mentioned. So I think having those tools and information to implement good stewardship on the farm could parallel nicely with what's happening on the human side.
Okay, thank you. So we're going to I'm going to ask one more question because I want to leave a little time for you folks to ask. Earlier this week, the World Health Organization issued a report that found wide disparities in antibiotic usage among dozens of countries. They didn't include the US, India, and China, unfortunately. They were not able to get enough data from India and China, and the way that the metrics are set up in the US did not match what they gathered from around the world. But in any event, there are dozens of countries they explored, and the bottom line was they found that, at least the bottom line suggestion was that overusage exists in many parts of the world, or access is simply insufficient. And going back to that UK report from 2 years ago, those folks argued that diagnostics could and should be used to make sure the right antibiotics are taken at the right time in order to overcome some of the financial barriers we talked about, and also the cultural barriers that the WHO found. So I'm wondering what you folks think about how we can address that problem.
So I'll address your point about diagnostics. So diagnostic stewardship really is antimicrobial stewardship. In order to really know whether you're using antibiotics in the right way or you have a correct indication for antibiotics, you really need to make the correct diagnosis, and that applies, I think, in the human and the agricultural setting. Working on and improving our laboratory capabilities is an important part that's probably not as much part of the conversation in terms of rapid diagnostics, in terms of differentiating between bacterial and viral infections. So antimicrobial biotics are needed for a bacterial infection, but not for most viral infections. And we are really starting to figure out how best to incorporate those in the healthcare setting. There's a really big caveat, I think, with diagnostic stewardship, and I think that is that more isn't always better. That you can have new and improved infectious disease diagnostic tests, but they really have to be deployed in a very careful manner. So there's a lot of study in this in terms of, for example, certain laboratory tests, which if they're not paired with an action item, with a person taking, an educated person taking action on that item, really all your effort is for naught. That there's really no point in spending all that money, and these diagnostic tests can be very, very expensive. There's no real point unless you pair that with a stewardship intervention where someone actually acts on that. And there's a lot of studies which show that sometimes antimicrobial utilization is worse or the same, even if you have these rapid diagnostics. So I think that diagnostics very much need to be a part of the antimicrobial stewardship conversation in a way that some other things that don't get attention as well should be part of the conversation, like other measures to prevent infection, such as vaccines or other new and different kinds of therapeutics, like monoclonal antibodies, which can be also important in treatment of infections.
All right, well, we have a few minutes left. Anyone would like to ask a question? This is a good time. We have another panel coming up. Yes?
Just wait for the microphone because it's being recorded, please.
Thank you. I want to thank the organizers of this program. I think it's a very important thing for us to face the matters of the future before they arise. I really don't want to ask a question. I want us to look at, I apologize for my accent, please. I want us to look at this problem from a different perspective. So I'm from Nigeria. I'm a medical doctor from Nigeria. And so I'm going to talk from the perspective of human medicine. So if we are talking about antibiotic resistance and then we are looking at the food industry, remember that when meat comes from the farm, the meat is first processed. You cook the meat, and then before you eat it, how many cases of of diseases, of illnesses have been recorded from actually eating meat that has been treated with series of antibiotics as we are claiming? Another thing is that if we are to really pinpoint or identify antibiotic resistance as duly basically from the food and drug industry, how many farmers or how many vet doctors have come down with diseases that antibiotics cannot treat? So in treating antibiotic resistance, we should not only treat the headache, but treat the cause of the headache. So I'm going to say that why not look at it from the angle of, because most of these diseases that don't have cure, that we see, they are usually caused by doctors. We doctors are the cause. We usually place our patients on longer than a due course on prophylactic antibiotics. Apart from that, another thing that the pharmaceutical industry is, I can accuse pharmaceutical industry of doing is that when they produce new drugs, for instance in Africa, when they produce new drugs, they don't tell us that, oh, these old drugs are still good for what we are doing. But then the new drugs is what we'll continue to use. For instance, let's say I have a patient with cellulitis, which is a boil. I should basically normally use a penicillin-based treatment, or maybe use something like amoxicillin. But because augmentin is a new thing, the pharmaceutical industry has come to meet me. Augmentin is used new drug and it's wonderful. So, make sure we have time for other questions. Oh, I'm so sorry. I just want to paint my. I'm very sorry. I'll try to wrap up. I will leave that one and go to augmentin and begin to use that one, and I'm causing the antibiotic resistance. I'm sure that medical people here can point to the fact that really we should face the cause, which is from the clinical perspective. I'm not saying that daily use of antibiotics on the farm is good, but I'm saying that looking at the problem from where it's caused, not finding solutions. If we find new drugs and find new methods of financing, one day we will still come and sit down and talk about how those drugs, some other superbugs have developed resistance to them. Why not kill the problem before you go and find another solution to it? Thank you.
Thank you. We're getting close to the end of the session, but if anyone else would like to ask a question, back there.
Hi, thanks for being here. I was wondering, you've talked a bit about antibiotics in human use, but I was wondering in animal use, what, for example, what incentives do you think the meat industry should be offered in order to curb their antibiotic use? Because currently there are absolutely no incentives for them to not routinely use antibiotics because, as is, the only way they can sell meat is if the meat has never been ill. And so what sort of incentives do you think should be going on that end?
I can chime in on this one really quick. So this is going to come up very soon, and there will be a more in-depth response. But I think what we've seen as biggest area of progress here and incentives, to your question, is consumers are more aware of this problem. Consumers are more aware of antibiotic resistance now. There was just a representative poll from Consumer Reports that talked about people, more than half of consumers would be more likely to eat at a restaurant that serves meat raised without antibiotics. So I think that's the incentive. The mindset is changing. And to your point about the never having been ill, so we think sick animals should be treated, and we encourage companies, if they are going to move in this direction, to have that be part of the system, right? If an animal's sick, they should be treated with antibiotics. And that, again, similar to human health care, if illness is present, take care of it. But I think that's the incentive really comes down to the consumer awareness and that push, and we're seeing more and more companies move in this direction of reducing antibiotic use as a result, and more meat producers doing the same thing. So that to me is the biggest incentive they could have right now.
Any other questions? There's one right here.
Hi, thanks for the discussion. I just had a quick question. I believe that the FDA recently announced a strategic plan to combat antimicrobial resistance. I just wanted to hear if any of you are familiar with the plan and any perspectives, hopes, or skepticisms regarding that plan.
I think I can say something quick. I'm sure Kathy will want to speak to this one. I think it's definitely encouraging. I think it's great that Commissioner Gottlieb has come out with this plan, and I think there's some ambitious goals in there, one of which that I'm really excited about is limiting durations of antibiotic use in food production. There's many indications for medically important antibiotics that have sometimes no duration limits. Producers can use them continuously, which of course would not be a good idea for antibiotic resistance. And so that was one of the objectives laid out in this 5-year plan, is the FDA wants to take steps to limit duration use, which is a good thing. So I think definitely some good things in there, but I'm sure Kathy has some more.
Sure, I just sort of adding to that, I agree. I'm glad they put it out. I think it shows some good sort of looking forward to what they can do. As I mentioned before, so the things that we find most encouraging there are getting all antibiotics under veterinary oversight, having the labels aligned with judicious use principles, improving the data collection. I think that one piece of it that concerns me a little bit is the timelines are vague. So what we'll be doing is continuously sort of holding FDA accountable, asking them for timelines, more sort of clear timelines on when some of these actions are going to happen. But it's a good start.
Okay, and with that, we're out of time. Thank you all, and stay tuned. We're going to have another panel start momentarily.
Thank you, Kathy.
Thank you.
Sorry, Kathy. Yeah, I switched over. Hopefully. Okay. Wonderful. So while we have the panelists switching out, I wanted to introduce just a little bit of background. I know we heard a little bit about the food industry side of things, but wanted to just put some things into context before we get started on the second panel. Wonderful. Oops. Okay, great. So I know we've talked a lot about this problem already. I'm glad that some of the other panelists were able to address the issue. But as we have sort of talked about, although misuse in the medical setting is a big problem, in the United States, 70% of medically important antibiotics that are sold are intended for use on food animals. And as of 2016, the beef industry purchased the most medically important antibiotics out of any meat sector. So we were able to talk a little bit about where we are at the federal level. Again, this policy is all, or this panel is all about how food companies have outpaced policy. But just to contextualize and remind folks, so the FDA has come out with a few guidances that essentially ban antibiotic use for growth promotion, but allows this loophole for disease prevention. In December of 2017, they released, for the first time, species-specific sales data. So that laid out very clearly, when you look at all the antibiotics that are going into the food industry, what species is getting what percentage of it. But the overall takeaway that I think the panelists in the last panel were talking about is that the federal government just hasn't done enough, and we need more in all sorts of different ways when it comes to our federal government and its policies. I did want to highlight the fact that there has been some state-based efforts, both in Maryland and California. Bills have been passed that ban the routine use of antibiotics on farms in those states. We've seen a couple other initiatives pop up, one in Illinois, trying to make some progress there, but again, very similar stories we see at the federal level, just not enough action. So I wanted to talk a little bit about just why we're focusing on food companies. So this year, in a report that US PIRG was the lead author on, it was released by 6 other major consumer and environmental organizations as well. We looked at just this fact, where fast food companies stand in terms of their antibiotic stewardship policies. So this was the 4th annual report, and for the past 3 years, we've graded the antibiotics policies of the top 25 U.S. fast food chains, and this year we were pleased to see that 17 out of the top 25 received a grade above an F. Just to contextualize this, 3 years ago that number was only 5, so a lot of improvement has been made in the last 3 years. But this year's chain reaction report really focused specifically on the beef industry. As I highlighted before, the main reason is that there's just been the least amount of progress in that industry. And so this year we focused, rather than the top 25 fast food chains, the top 25 US burger chains. And as you can see, this is a slightly different story than the last scorecard. We saw that only 3 companies out of the top 25 had a grade above an F. So that's not so great. But what it really was, the main point of this scorecard is that we wanted to just highlight the fact that the beef industry has been really slow to act when compared to the poultry industry. But after the release of this report, McDonald's, who's the largest beef purchaser in the United States, came out publicly saying that they would commit to a global antibiotics policy by the end of this year. We're excited to see where that goes, and I think all of us in this room who know about this, this commitment want this to be as strong as it can be, but really goes to show the power of consumer pressure and how vulnerable some of these companies can be. So before we kind of get into the next panel, I just want to say that I think the panelists today will really be able to talk about this issue and how we've seen companies set up and how this should be influencing policy. They'll introduce themselves, but we have a really nice diverse background here that's going to be able to talk about this issue. But now it's my pleasure to introduce the moderator for the second panel, Chris Green. Chris is the executive director of Harvard Law School's Animal Law and Policy program. He's a graduate of Harvard Law School and the University of Illinois, where he created the college's first environmental science degree. Chris previously was the director of legislative affairs for the Animal Legal Defense Fund and is a former chair of the American Bar Association's Animal Law Committee. He's been published in the Animal Law Review, won first prize in an inaugural national animal law competition, regularly testifies at legislative hearings, and is consulted on animal legal issues for dozens of major media outlets. Chris has also spent several decades working in the fine arts, film, and music industries, and currently manages an Illinois farm that has remained in his family for 180 consecutive years. So, Chris, I will let you take it away from here.
Great, thanks. I apologize for you all to have to suffer through my bio. So yeah, we've got a really good panel today, and thanks so much to PIRG for doing the lion's share of organizing this. It's been a really pleasure to co-host this with him.
Oh yeah.
So we've got the second panelist is going to focus a little bit more on sort of the policy side of things. So to my immediate right, we've got Nicole Negawetti, who's the clinical instructor at the Harvard Food Law and Policy Clinic, which is another one of the co-sponsors today. Then we've got Jared Fernandez, who's a shareholder advocate at Green Century Capital Management. And at the far right, we've got Maria Belize, who's the Senior Director of Communication and Strategic
Because we
Partnerships.
recorded you, is there any way you could fill this out just so we can legally say this?
I don't know, we're hearing something somewhere.
Oh, no, it's totally fine. If you could just...
Kathy, if you can hear us, can you mute, please?
Thanks.
I guess we'll, if we can go from furthest, if you want to go first, Maria?
Sure.
Great.
Hi, thank you, everyone. Really pleased to be here. For any of you who are not familiar, Applegate is a natural and organic meat company based in New Jersey. You'll find us in supermarkets and grocery stores all over the country, but primarily mostly in Whole Foods and in natural food stores. Applegate is we like to say we're a mission-based company, and that's our mission right up there on the screen. I'm sorry, it's a bit of an eye chart, but our mission is basically changing the meat we eat, and a core value of the company is that we believe that the way food is raised can change and transform lives from the farmer who grows it to the person who eats it. And really what that boils down to, and what the company's been around since 1987, is we like to say that we are food rebels with a cause. So we've really been fighting on the antibiotics front really since the beginning of our company. If you move forward, so this has basically been our antibiotic journey. The company was founded in 1987, and in 1990, that's when we introduced our first deli meat that was made from animals that were raised without antibiotics. From then, just fast forwarding 2010, I mean, one thing I wanted to point out that really shows how we've grown and the antibiotic-free movement has grown, thank you, is that when we started, there were fewer than 10 farms in our network that we sourced from. By 2010, when the founder of our company had an interview with Katie Couric on CBS Evening News about the use of antibiotics and the scourge of antibiotic resistance in the U.S., we were already up to 300 farms that were sourcing animals to us that were raised without antibiotics. We decided to start Citizens Against Superbugs. We launched a campaign to try to educate folks about antibiotics. 2013, that's when the FDA issued their guidance. I think we talked about that in the last panel. And in 2014, one of the things that we're really proud of is we funded a documentary called Resistance that's available on Netflix if you'd like to take a look, that really follows why antibiotics in the animal agriculture is the history of antibiotics in animal agriculture and where we are today and how we can stem that tide. And 2015, 2018, we went from fewer than 10 farms to over 2,800 farms in our network, raising all 4 species. So we raise chickens, turkeys, beef, and pork, all antibiotic, no antibiotics, and all third-party certified for animal welfare. And one of the things our CEO said to Katie Couric is, would you spoon antibiotics on your kids' cereal every morning? And basically that's at the heart of animal agriculture and antibiotics, and that's how most conventional food companies are treating antibiotics and their animals. And of course you wouldn't do that to your kids' cereal. And once you tell consumers that and really put it to them through that prism and that perspective, they really get it. Here are some of the things that we've done. Besides Resistance, we took out an ad in Politico. I think that was in 2014 before we, so really kind of tweaking the Obama administration, asking them to do a little bit more on the antibiotics front in terms of stewardship. Dear MRSA President and Chief of Staff, I'm proud of that one. And Resistance, what we did with that is we sponsored screenings with partners like Pew and Environmental Working Group and other nonprofit organizations who were in the fight with us, and did Capitol Hill screenings, worked with a representative who has since passed away, Louise Slaughter, in trying to spread the word, trying to get policy going on Capitol Hill, still slow going. And now the film is available on Netflix in 19 languages, and you should take a look. And you know, there has been progress. There are people who have joined in because I think they've seen that that's where consumers are going. There are a lot of more and more consumers voting with their pocketbooks and wanting products that are raised without antibiotics. Chick-fil-A, that was the big one when they said they were going to do, I think it was by 2020. But then again, there's still work ahead, and I'm sure we'll talk about this. And this is one of the larger chicken companies here in the U.S. who is trying to tell us that antibiotics in the animal agriculture system and labeling, and we're just trying to sell you a bill of goods. It's just a marketing gimmick. It's not a big deal. So, thank you for having me.
Great, thanks. Next to Jared, if you want to go next.
Sure, thank you. And good evening, everybody. My name is Jared Fernandez, and I'm a shareholder advocate with Green Century Capital Management. Green Century is a environmentally responsible mutual fund company based just over the river in Boston. And beyond our sustainable investment strategy, where we seek to invest in solutions-oriented companies, we're sort of unique in that we really leverage our position as shareholders in companies to push them for more sustainable and responsible business practices within their operations and their supply chains. Sort of both as a way to mitigate business risk for the company, but also as a way to address some of the most massive challenges that we're facing, both on the environmental and social side. So some of you may be wondering why a mutual fund company is here today to talk to you about antibiotic-resistant superbugs. But the truth is that investors have been really concerned about this issue for quite a while. And from our perspective, it should be enough, the threat of illnesses and deaths rapidly increasing across the globe over the next few decades for our society to really re-look at every single use and application of these drugs. But the fact is that there are significant business risks as well for companies that may be exposed to unresponsible antibiotic use within their supply chains. Matt talked about the statistic. Almost 60% of consumers in America now say that they would be more likely to eat at a restaurant if that restaurant served meat that was not raised with antibiotics. Purdue was just up on the screen. Consider the fact that Purdue says that their conventional chicken sales, they rise about 1% to 3% every year. Their antibiotic-free chicken sales, those are rising about 15% to 20% per year. Consider the fact, again, California and Maryland now have bills on the book that restrict the use of antibiotics on a routine basis on farms, and we've seen similar bills introduced in about 7 other states. What that really tells us is that companies that are not actively working to mitigate this risk within their supply chain and not actively working to minimize the use of these antibiotics, they're effectively not listening to consumer demand. They are restricting their market access, and they're potentially exposing themselves to both gaps in supply and price shocks if legislation is enacted in states where their suppliers are located. So that's why Green Century, we've worked with companies like Jack in the Box and Starbucks to secure commitments from them to adopt policies for responsible antibiotic use on their farms. And actually just this week, we worked with Starbucks back in 2016, and we filed a shareholder resolution with the company and got them to agree to make a commitment that by 2020 they would eliminate the routine use of medically important antibiotics in their poultry supply chain. Well, they actually just announced this week that 2 years early, they took it a step further and have worked with their suppliers to now only source both chicken and turkey that has never been given antibiotics. But we also work to push a lot of the laggards in the space. Darden Restaurants is one that comes to mind. They are owner of Olive Garden, which is a perennial F on the chain reaction scorecard that you saw earlier. They also own Longhorn Steakhouse and a few other regional chains in the country. We filed a shareholder proposal with them this year for now the 3rd year in a row. And the ask of this proposal was for the company to issue a report to its shareholders assessing the feasibility, not even adopting a policy, but just assessing the feasibility of adopting a policy that would eliminate this practice from their meat supply chain. The company balked at the idea, but its shareholders didn't. 40.2% of Darden shareholders voted in support of our proposal. This is the 2nd highest vote that a shareholder proposal on antibiotic use has ever received. And I think more importantly, it was over $650 million worth of Darden shareholder money that was saying that the company is not being responsive enough to this issue, and they need to explain themselves if they are not going to adopt policies that are in line with industry peers. So I think with that, I'll cede the floor, but I'm thrilled to be here and looking forward to the discussion.
So alphabetically last, we have Nicole Negaweti.
Good evening, everyone. Thanks for being here. Thank you to Shelby and the other organizers. So as Chris mentioned, I teach here at Harvard's Food Law and Policy Clinic, and I was previously policy director of the Good Food Institute and worked with transformative startup food companies. So in my role here and at the Good Food Institute, I recognize the importance of having strong laws and policies, but I also recognize the limitations. And I recognize the potential for food companies to take a leadership role in transforming the food system. So I'm thrilled to be discussing this really important issue. And last week, I was in Baltimore attending a food systems conference, and I heard Dr. Lance Price, who's a microbiologist and the director of the Antibiotic Resistance Action Center, proclaim that antibiotic resistance is of critical importance, second only to climate change. So this is an issue that we need to be discussing, that we need to do something about. And from my perspective as someone who focuses on animal welfare and food justice and food access, nutrition and public health, all of those issues, this is an issue that's at the intersection of all of those issues, of public health, of animal welfare, and of farm worker justice. And we've talked a lot about the public health implications of the overuse of antibiotics. But antibiotic use props up industrial animal agriculture system by keeping animals alive in horrible conditions of close confinement and stressful conditions. And these conditions are also horrible for the workers. And from a justice perspective, antibiotic resistance disproportionately affects the farm workers who are working in close proximity with these animals on a daily basis. And what's particularly frustrating about this seemingly simple problem of overuse is that we can solve it, as Matt said, by stopping the routine use of antibiotics in animal feed. They should be used to treat infectious diseases. Yet, as we're discussing on this panel, and has already been mentioned throughout the evening, policy and regulatory action to curb antibiotic overuse has not kept pace with the urgency of this threat. And so we've already mentioned the FDA's voluntary judicious use policy and its focus on prohibiting the use of antibiotics for growth promotion. And as we've also mentioned, these policies are inadequate because it creates a massive loophole, a loophole that still allows 25 million pounds of antibiotics to be fed routinely to flocks and to herds. The growth promotion is just a very small reason for the use of antibiotics. And in this massive loophole, the FDA continues to allow prevention of disease. And that is the primary reason that antibiotics are being used in industrial agriculture. So there are several very promising policy solutions that we can implement at the federal level, and we've mentioned these throughout the evening: improving data collection, closer oversight of drug labels, phasing out routine use of antibiotics, improving oversight of veterinarians. But unfortunately, there are very good reasons to be pessimistic about the likelihood of success, at least at the federal level, for implementing all of these policies that are really good ideas and would have an impact. Some of those reasons are the administration's deregulatory agenda. The FDA, although, as we talked about its policy, it's just announced that it wants to take steps, it has still been confident in this voluntary approach. But the biggest hurdle, in my opinion, is that dramatic changes in the use regarding antibiotics really would require disruption to industrial agriculture. And in a way, FDA's voluntary program condones the use of antibiotics for disease prevention to compensate for the stressful, the crowded, and unsanitary conditions that exist at most factory farms. And so antibiotic resistance should be considered a very high cost to the production of so-called cheap food in the United States. And so there is good news, right? We're starting to hear it, not in the policy space, so I'm the bearer of bad news here, but from food companies, from investors who are really leading the charge. Shelby also mentioned that there are states that are passing laws, California, Maryland, that has come up. There are also some innovative policies that we're seeing even at the city level. For example, the San Francisco Board of Supervisors passed an ordinance last year requiring the city's largest grocers, and that included 122 stores in that city, to submit reports to city officials of the supplier's use of antibiotics. And we're also seeing attempts to utilize procurement policies, which can have a huge impact. So for example, the LA Unified School District became the first large school district to serve only chicken that's raised without antibiotics. And so in doing so, it approved $50 million in contracts. So that can have a big impact. So although the limitations of federal policy are discouraging, the successful initiatives that are underway by cities, by states, by consumer advocates, and the food industry exemplify how we need a multifaceted approach to address this issue. So I look forward to discussing all the possibilities. Thank you.
Great. Well, thank you so much. I've got several questions here. Before you take that off, I'm going to go to the last question first. So, as you can see above there, Sanderson Farms sort of denies any link between antibiotic use in food animals and risk to human health. As you can see, they've launched this marketing campaign to make the case to consumers, saying that it's all just a gimmick to make customers pay more. How should the public respond to this, and should policymakers respond or get involved to such claims?
Yes. It's my understanding, and I think we should have some of the doctors in the room speak to this point, but I don't think it's controversial that there is a link between the antibiotics that are being overused in farms and public health.
There is no dispute.
Okay.
So you get into sort of, consumer deception, false advertising, I guess, in such instances, right?
Yeah, I would say so, and I think the other thing, just not restricted to Sanderson Farms, is having gone through, not just for antibiotics, but anything that we put on our label at Applegate, having to go through the USDA labeling process, it is a little ridiculous. It's a wild, wild west of put what you want on the label about antibiotics and then send it to USDA, and you can asterisk it, tell us what you think you mean, because they have no guidelines on how to label antibiotics in food production. So you can have no antibiotics ever, which Applegate uses, and it also has an asterisk because we want to make sure consumers know that we do treat sick animals. But those animals are separated from our supply chain. But then you have, some people label antibiotic free, and some people label, no judicious use, or however they label it, and it's very confusing to consumers. And Sanderson is adding to the confusion by saying that it's a gimmick. So if USDA or FDA would step in and say, here are the guidelines for labeling antibiotics, that would cut that out of the equation, I think.
Part of the question was, should the public say anything about this? The public has. You remember I mentioned that our Darden proposal was the second highest proposal, antibiotic use proposal, that's ever been voted on. Sanderson was number one. Earlier this year in February, a shareholder proposal asking the company to completely eliminate the routine use of antibiotics in their production received 43% of their shareholder support. So, when a company that's this obstinate, when 43% of their shareholders are saying that they should really rethink their production practices, that's a pretty strong message. Do we in the investment community really think they're going to do anything about it? Probably not immediately. So maybe my suggestion to all of you is to go out and buy some Sanderson stock so that next year you can vote your proxies and make that vote total a little higher. But I guess to a certain extent this feeds into a larger problem we're having in the society, is just how do you combat fake news? Because that's what this is, and it's dangerous. It really is dangerous, some of the things they're saying. And so I don't know, in terms of policymakers, do we have to reach out to our legislative allies that we have in the states where Sanderson has production facilities and, try to get this debate more on the public stage versus corporate blog posts and regional television ads?
from a legal perspective, those of you who are litigators, I think we could potentially have grounds here for a lawsuit. We should alert either plaintiffs' attorneys or the FTC.
I was thinking about that.
This is on the website, right? This seems to be deceptive advertising.
Yeah, well, they've certainly, I think they've had lawyers look at it, because they're not actually making the claim, they're talking about someone else's claim, sort of saying the myth is only chickens raised without antibiotics are safe to eat. So they're not claiming the opposite. They're just saying, oh, there's this myth out there. By calling it a myth, they're sort of indicating that it's untrue. And I think there's a lot of confusion with consumers here that on this issue is that it's not the actual sort of antibiotics residue in the meat that they're eating that's causing the harm. It's the actual problem of the overuse of antibiotics is creating these superbugs. So there's it's a couple steps removed. So what Sanderson seems to be just focusing on the first part, oh, it's safe to eat our food. What are you talking about? And it's so they've obviously had lawyers look at this. So I think but they really are pushing the edge, and it really is insidious. So yeah, you can get rid of it now if you want. I guess back to the top. So how can policymakers build on the progress that food companies are making towards responsible antibiotic use, and what lessons can they pass on to lawmakers?
The policymakers are really lagging behind. So I'm not sure if they can keep up, or if the pathway forward is really to rely on consumer demand and industry taking the lead. But perhaps the consumer interest that is growing could be impetus for cities and states, and perhaps the FDA, maybe there's room there, to take more action and to enforce stronger policies. Because we will still be left in the industry with Sanderson Farms and others who are lagging behind. And my concern is whether, and I'd love to hear your perspective about whether costs for these antibiotic-free products will create a marketplace where only those who can afford antibiotic-free meat will be able to purchase those better products, and whether others will be left purchasing the products that were created from animals that were served antibiotics, whether it will cause kind of this problem in the marketplace. And then there's the question of using different labels and different standards. So we have organic, but then we have other claims that are being made that are also confusing to consumers. Natural, for instance, and consumer may believe, oh, that means it's antibiotic free, when that's not really the case. So we can have, there certainly all these benefits to having industry taking the lead and taking initiatives, but the problem is if we don't have policies that are applicable to all producers, there are problems as well for consumers.
According to the National Chicken Council, about half of the U.S. chicken industry right now has either eliminated medically important antibiotics from production or is in the process of it. And so it seems like in terms of policy, chicken might just be the best first place to start. It's not like even with now almost 50%, it's not like we've seen prices of chicken skyrocket or mortality rates soaring through the roof. And we've even heard from Purdue, who about, I think at this point, maybe 60 to 70% of Purdue Farms' poultry production at this point is never ever. Birds that have never been given antibiotics. And they've been public in saying that they did not have to raise prices. They've been public in saying that mortality rates have not increased. So, I think this is pretty crucial to demonstrate that it can be done, and poultry might just be sort of the first domino that has to fall from a policy standpoint.
I think you bring up a good point about cost, and it's such a complicated issue because chicken, I think chicken is a great place to start. I'm not an animal scientist, but having worked at Applegate for quite a long time and being on farms, chickens are an easy start, an easy entry point for antibiotics because chickens just the reality is chickens don't live as long, they don't eat as much, their life cycle is about 6 weeks for harvesting, so it's a lot easier to raise a chicken without antibiotics and not have to worry about them getting sick. Then you start getting into the animal welfare issues of raising hogs and raising beef without antibiotics, because you can't just take antibiotics out of the system. there are a lot of preventative measures that have to be in place in order for those animals to be healthy, and that means space, not having them in confinement, no crates, giving them, better feed, and those are all real costs that do get passed on to the consumer. So it's all, but then at the end of the day, when you, I'm sorry, I hate using that phrase, but at the end of the day, it's really indicative of a broken food system, because why are we because there are certainly the shared costs as a society from antibiotic resistance and people in hospitals and people getting sick. So don't we want, let's pay more for the food so we don't have people getting sick. Our motto is eat less meat, eat better meat.
So I was going to ask, kind of answer some of the question here, what some of the differences are in antibiotic use between meat sectors and why, and how do approaches to antibiotic stewardship differ for each of those sectors?
So Applegate's policy is no antibiotics ever on for all of our species, and the differences are really the life cycle of the animal. Like I said, chickens are about 6 weeks, turkeys a little bit longer, hogs, I think it's about 4 to 6 months before they go to market, and then cattle even longer. So, you're talking, and cattle also bring with them the added complication of most cattle in this country are corn-fed, and cows aren't meant to eat corn, and that makes them grow faster, but it also makes them sick, and then you give them antibiotics. So cattle are meant to be grass-fed. So there are all of these complications that go into it, and I think even though Applegate has for the last 30 years really talked about antibiotics, over the last 2 years we've really been trying to educate consumers more about animal welfare, because I think antibiotics and animal welfare really go hand in hand in terms of an issue that needs to be addressed in the food system.
So what has the federal government done so far to address antibiotic overuse in food animal production? And if not, I don't think there's actually much. So if not, what has been done at the state level, and is that enough? I'm sure it's not, but just if you could talk a bit more about sort of even maybe at the local level.
Yeah, so I think we've already exhausted what the FDA has done in its voluntary guidance it has put forth. Basically the same guidance, but to different audiences, to farmers in guidance to Industry 209, and then directed to the drug industry in guidance 213, that has them change the labels to make sure that you don't have on the label that you can use the antibiotic for growth promotion. And then has a directive to veterinarians that they need to kind of oversee the use of medically important antibiotics. So again, these are all voluntary. So that's what the FDA has been doing. And so states are trying to go a bit further. And so we mentioned what was passed in California. That is the most far-reaching policy that has been enacted. And so it's very promising, because California has the third largest livestock industry in the country. And so it restricts certain uses of antibiotics for disease prevention. So that's why it's going further than the FDA. The FDA allows the use of antibiotics for disease prevention. And then what's also very promising is that it requires the California Department of Food and Ag to collect data on the sales and use of medically important antibiotics from livestock producers in the state. And so the Maryland law is similar, but it doesn't have the same data collection requirement. And then, as was also mentioned, there were bills that have been proposed, and I think PIRG has been working on campaigns in various other states as well. So those bills do address the problem and the solution, which is stopping the routine use of antibiotics.
And so, if it seems so clear and people are trying, why do you think policy enactment has been so slow for the issue, and what forces do advocates need to counteract in order to ensure that strong policies are instituted?
I think it's probably about the cost to the industry of implementing those changes. Do you think that's right?
I think so. I mean, a lot of times, the argument I hear a lot from whenever you want to, whether it's antibiotics policy or GMO policy, which could be a whole other, is, well, how can we feed the world?
Yes.
It's like, well, the reality is we're really not feeding the world now, are we? So, I mean, with all the food waste and everything else, and the amount of hunger there is in the world. And I just ordered my turkey from him, Will Harris, at White Oak Pastures in Georgia. He's a farmer, regenerative, he's a Savory Institute hub, does regenerative agriculture. And that's a whole other topic as well. But I remember when someone said to him, like, well, how can you feed the world? And he's like, well, I'm not sure that's my responsibility. Maybe I'm not supposed to feed the world. I'm just supposed to feed the people around me. So I think that argument has been used as sort of a cudgel in the food industry. It was like, well, we've got to do it. How are we going to feed all these people? I would really like to see the disease prevention loophole, because the doctors here could tell us, like, in human medicine, you would never give anybody an antibiotic for disease prevention. That's the whole that's the whole problem, right? So the fact that that is put in there has just given the food industry the opportunity to say, well, sure, it's for disease prevention.
I'm sure corporate lobbying influence has something to do with it as well. I mean, between the drug companies and the meat industry, there's a lot of money at stake. Sure. But I think that it's also true when we're talking about developing policy. There are differences between the husbandry practices of poultry, pork, and beef, and so, getting any sort of overarching policy that talks about routine antibiotic use, it's probably going to have to come with separate timelines for different animals to be fully implemented. It's probably going to have to come with some sort of incentive package, or if not, then some really well-funded education program for producers.
Mm-hmm. Right. Well, how do you think the food companies, such as Applegate, who are doing it right, how can they best discuss the issue with consumers and sort of report their progress to both consumers, policymakers, and advocates, do you think?
Well, we actually have a dashboard on our website, and we talk about the millions of pounds of antibiotics that are used every year in conventional, and what our contribution is to that, which is 0. But so we report that out, and the number of farms that are in our system. For policy, we support groups like PIRG. We work with Dr. Lance Price. We support research. And the other thing that we try to do is to try to bring our partners along in the industry. We want people to join us and to save antibiotics. I'd like to say, I'm less afraid of the competition and I'm more afraid of superbugs. And we were bought by Hormel, which is, everyone's like big bad food company, but in 2015, we're still doing our thing in terms of advocating for antibiotics policy, but we like to say we're infecting the host. Talking to Hormel, introducing Hormel to the right people like Dr. Lance Price, and getting them to think more broadly about their supply chain. So, and actually Jenny O Turkey Store, which is owned by Hormel, now has turkeys raised without antibiotics. So I'd like to think maybe Applegate has something to do with that.
Oh, great.
I don't know, maybe not.
From the investor standpoint, we rely wholly on publicly available information. And we tell companies all the time, you can be doing as much as you want behind the scenes, but if you aren't actively talking about it and promoting it, you might as well not be doing it, because we can't make informed decisions otherwise. So, I think for us, disclosure is huge, and whether it be a tracker on a website or what every company seems to be putting out, a corporate social responsibility report these days, that's critical. And ultimately what we need is for companies with exposure to antibiotics within their supply chain, the section on antibiotics and how they're managing that and working with their suppliers, that needs to be just as large and just as quantitative and just as detailed as their sections on climate change and greenhouse gas reduction. And what we also really need is clarity from companies. And so, in my job, I look at corporate statements on antibiotic use where they're saying things like, we're proud to say that we now serve chicken raised without antibiotics. Do you only serve chicken raised without antibiotics? Did you serve 2 last year? We need a little bit more clarity. Or companies that claim to have a responsible antibiotic use policy because they follow FDA guidelines. Well, as we've talked about tonight, that doesn't really go far enough. And I think the third thing that we really think that corporations could be doing is some form of education around this as well. And so, the thing that I think about is Chipotle. So Chipotle now serves beef, pork, poultry raised without the routine use of medically important antibiotics. And when they made the switch, they had to raise the price of their carnitas up $1. But they did it with a little placard on top of all of the sneeze guards, basically explaining to customers why they had to do the price increase. The sales of carnitas doubled immediately. And so I think that what we're seeing is that there is a willingness to pay for this if you're able to effectively communicate it. And I mean, talk about building brand loyalty and brand trust. You want to be the fast food company who's being out there and saying, hey, we're actively working to fight antibiotic resistance. So, I think clarity, disclosure, and education are 3 things that companies could and should be doing.
Yeah, great. Well, with that, I think we should open up to the crowd for some questions.
Yeah, I also just wanted to add in quickly, the scorecards that I brought up here before, that's one of the things that companies are graded on, is how transparent they are, and how willing they are to talk with us. So it's something that, we are trying to call them out for, and I think, what the panelists were saying is all true. I just want to clarify that's part of the grade.
Thank you for that discussion. I just wanted to clarify that actually in human medicine, we do use antibiotics as prophylaxis to prevent infections, but that actually just makes it more complicated because then our job, we're at the Department of Public Health, is harder because to measure when that is indicated versus not makes tracking more difficult. So while I have the microphone, I'll just ask a question too. So now in an environment where expertise is questioned and credibility of scientists in general is doubted, all the fake news and all of that, what are your thoughts about what can public health people do to improve that, the consumer?
Be loud. I don't know, and every opportunity you have to push back against claims like this, I think, like I alluded to earlier, I mean, it's the fundamental question of our time right now, apparently, is how do we combat fake news? And I mean, ultimately, the facts are on our side, and the truth is on our side, and so we just have to be as loud as we can.
Did you have a question?
Very nice discussion of use of antibiotics. I sort of put them into a few categories that you spoke about. Disease prevention in livestock, growth promotion in livestock, disease treatment for livestock, disease treatment for humans, and I would add disease treatment for non-livestock animals. Are there different classes of antibiotics being used for these different purposes? And can you comment, if so, on the ethics and the economics of sort of restricting, I would like to say the good stuff for humans. But especially when a new class of antibiotics comes out, how does this work, and how is the oversight done?
I don't know. Since Applegate doesn't use any, I'm not exactly sure. I do know that there are different classes of antibiotics, and I know that there isn't something like ionophores that are used a lot, but they're not really classified as antibiotics, but they're sort of antimicrobial.
Yeah. Guest appearance.
Yeah, I think it's a great question. So the World Health Organization, they just came out with guidelines pretty much a year ago from this week during Antibiotic Awareness Week last year. And it was based on the scientific concern around overusing antibiotics on industrial farms. Is that having risk for human health? And they found, yes, it does. So their guidelines lay out very clearly we should restrict medically important antibiotics, so shared class antibiotics that are used in animal medicine and human medicine where you can have cross resistance, right? And that would affect human health. Those classes of antibiotics should not be used on animals that are not sick. So basically, no use for growth promotion, no routine disease prevention use. They should only be used to treat animals that have been diagnosed with an illness by a licensed veterinarian, or in some cases, to control a verified disease outbreak. They went a step further and talked about because there's a scale. It's medically important antibiotics, highly important antibiotics, critically important antibiotics. The other public health folks in the room can probably speak to this even more, but they went a step further to say we should not be using the highest priority critically important antibiotics in food animal productions at all. And that definitely, as you said, that's an ethical question. It's something that we have to make a decision on about, do we prioritize those last line antibiotics at all costs for human health? I think we would come down on the side of yes, we should be doing that because there are other options that food animal producers should be using. First off, to just prevent disease naturally without having to rely on antibiotics. So there are different classes of antibiotics. Some are more important to human health. The World Health Organization in these guidelines, they say those highest priority, critically important ones, as if that's not enough to say they're really important, those shouldn't be used at all in food animal production. There's definitely food producers, I think, have thoughts about this because they care about their animals. I understand that. From an antibiotic resistance standpoint, I think we should reserve those absolute last line treatments for human use. But I think that's always a discussion that we're having with food producers and how to make a difference on this. And then there are others. I think Maria mentioned ionophores that are not important to human health. There's a section of antibiotics that are not really, at least as of right now, we don't think they're important for human health that are being used in food animal production.
Okay,
Happy to make the appearance.
Before we pick it up for food. No?
Well, cool. I'd just like to mention we've got several other sponsors here that co-sponsors that are here. I'd just like to say a quick thanks to, in addition to the PIRG and Animal Law and Policy Program and the Harvard Food Law and Policy Clinic, also the Petrie Farm Center on Biotechnology is here. One of the sponsors, the Harvard Food Law Lab, the Harvard Animal Law Society, a student group, and another student group, the Harvard Food Law Society. So thank them all for helping spread the word. And please give a great, help me thank the wonderful panel that we had of Maria, Jared, and Nicole.